Hi everyone. This is Dr. Yousuf Siddiqui here from NutriChem, and we're celebrating that it's Naturopathic Medicine Week or Naturopathic Awareness Week. And today I'm going to be talking about specialized naturopathic testing and why I use it in my practice. A little bit about myself. I use a functional medicine approach coupled with naturopathic principles. And what that allows me to do is analyze and evaluate my patients' bodies, looking for basically imbalances. So when people experience illness, be it acute, be it chronic, it's typically because there's an imbalance in their system. And my job is to go through and evaluate all the different systems within the body itself, figure out where those deficiencies are, strengthen the deficiencies, so that the body can start to repair itself and heal a lot faster. And the reason why I use a ton of testing in my practice is that it provides an objective, measurable. So it allows me to not only listen to my patient's narrative or to their story, but it also provides information in the form of lab values that are without bias or minimal bias. So my favorite tests that I do quite a bit in my practice are the biggest one is the organic acid test. And in my clinical experience, it is by far my favorite in the sense that it's a urine test, and what it does is it looks at metabolites. So your body, if you look at the biochemistry of the body, there are all these pathways, and each pathway will eventually lead to something that's excreted from your body. And what the organic acid test does, it's very, very sciencey, is that it looks at what is in your urine, so what the byproducts of these various biochemical processes are, and we trace them backwards up into the body, and we use then the urine as a way of testing how the body's functioning at the moment in time that the sample was given. So what that allows me to do is look at a ton of markers. We can look at byproducts from certain groups of bacteria, yeast, candida, that are commonly found within the digestive tract. We can look at nutritional markers. So we can start looking at your B vitamin status, CoQ10, and acetylcysteine, glutathione, which is so important for the detoxification pathways in the body. We look at the urea cycle, so another detox pathway. We look at the big one is mitochondrial function, of course, like biochemistry 101. So the Krebs cycle. So we know within the Krebs cycle, I don't know if you guys remember from university, but it's a cycle, step 1 to step 2 to step 3 to step 4. And the overall process is to produce what's known as ATP, and ATP is what gives us energy. And within the Krebs cycle, we know that there are certain vitamins that are required to go from step 1 to step 2. And so if you're deficient or your body's not absorbing and utilizing vitamins, this process becomes really, really compromised. And as a result, you can develop what's called mitochondrial dysfunction, and then that leads to a bunch of treatments. So my favorite test by far is the organic acid test. Who I think everyone should have an organic acid test, because it's a great way if you're with health optimization. It's like, okay, where's the tweaking with individuals with chronic illness? We're looking at like supporting kind of root cause imbalances within the body. Another patient base that I find really helpful for the organic acid test is individuals who have so much going on in their body. They've been sick, they've seen practitioner after practitioner, they tried everything and anything under the sun. And what the organic acid test does is it allows us to start to bring focus to the treatment plan and really start restructuring and supporting the body's natural biochemistry so it can start getting a lot stronger and a lot faster. I find that it just leads to a more precise treatment. Other laboratory testing that I do within my practice, which I think is really, really important for individuals with energy issues, is a full thyroid screen. So thyroid is through conventional medicine, typically just TSH is tested. So it's, in the panels that I do, we test TSH, T3, T4. So we're looking at not only the thyroid stimulating hormone that comes from your brain to turn your thyroid on. Not only is it doing that, not only are we measuring that, we're also measuring T4, which is produced by your thyroid, as well as T3, which becomes the active form. Often in my practice, I'll see individuals who have fatigue. Their TSH is within like conventional lab values, but when we run our panels, or I do my panels, and T4 and T3 are included, you can quickly see that the source of their low energy is due to what's called subclinical hyperthyroidism. And in those cases, certain nutritional support, orthomolecular support, and in some cases, desiccated thyroid are really great solutions. So within blood work, so I'm jumping around a little bit. So blood work. So what's really important with blood work is that we look at all the systems within the body. And here at NutriChem, we have a really comprehensive blood test that actually goes with the organic acid test. And what that's doing is that's giving me information as to what's going on in your blood. In all honesty, some tests are really, really great at providing a diagnosis, and some tend to just give us more general information, but it's letting us know what goes on in the body. So within the blood testing, there's conventional things like your red blood cells and your white blood cells. We do a liver screens. We're looking at your 2 liver markers. But where we start going a little bit more depth, so we're looking at digestion, we start looking at lipase. So we're looking at your pancreatic and potentially gallbladder function. Again, I mentioned earlier thyroid, so we're looking at your TSH, T3, T4. So we're looking at not just big picture, but we're getting more into the nitty gritty as to how your body's functioning. We check your sex hormones, so for men and women. And the panel will also includes cortisol and DHEA, which are produced by your adrenal gland, and they're a great way of measuring your energy production. There are a bunch more markers that I'm not remembering. We do a lipid panel, look at your cholesterols, and that's to see how that's going. We check your high sensitivity CRP. It's been a long day. And that we're looking at inflammation in the body, specifically relating to cardiovascular systems. And that lets us know, really in a non-specific, non-sensitive way, but like how your body's functioning. Are you an inflamed person or are you not an inflamed person? So a lot of patients, not everyone, but a lot of patients that come in will do both testing together. And so the urine test and the blood test. And what that does, it gives me a really detailed screen. If I'm not mistaken, there's about 100 markers that that I would be evaluating before you come in for your appointment, and be reviewing together in quite a bit of detail. We're looking at the metabolites, so what your body's excreting and how the biochemistry is functioning. And then we're also looking at what's going on in your blood. And when we pair the two together, we get a pretty precise treatment plan that allows us to get our patients feeling a lot better and a lot faster. There are tons of other laboratory tests. Those two are my favorite as a pairing. For individuals with digestive complaints, I do comprehensive stool testing. Individuals who have chronic infections, I do a lot of heavy metal testing, and that can either be done through hair or it can be done through urine. My preference now is more towards urine, less towards hair, but hair still has its place. Comprehensive stool analysis are great too for individuals who have dysbiotic guts or potential parasite exposure. We do iodine testing for individuals with thyroid concerns. Gosh, the list just goes on and on. But what's really interesting is through all of this testing is it increases my ability to provide more precise treatment plans that allows my patients to get feeling a lot better. So if you're interested in anything that I talked about, any of my rambling about all these tests, feel free to give us a call here at the clinic at NutriChem at our new location, which is really beautiful. And we'd be happy to answer them. Thanks for listening and have a great day.